This is baby Ella, and she was born on January 8, 2010. She was 10 weeks early. The private rooms here in the NICU were really nice. I seemed to really enjoy it when I was here during the day.
It made a big difference of just knowing that when you went to go spend time with her, it was time with her, it wasn't hectic, and there weren't constantly people around. You could sit there and hold her for hours if you wanted to, and there wasn't any issue with that. There wasn't a schedule to keep except hers. So.
Tyler came at 29 weeks. He was 1,100 grams, or 2.6. We stayed here at the NICU for 57 days. And the volunteer staff would always come around, and they always had gatherings where the parents could come, the previous parents, and we can talk about how they got through their experience, which helped us with our experience.
The staff, especially the nurses, were so compassionate and kind, but also so talented that we felt even better with Gabriel being here than if he had been home. We knew that he was very safe here and very well cared for. And they also helped us relax. They really normalized it. They made the experience like this happens.
My husband and I were here with our daughter Jordan. She was born at 30 weeks gestation, and she was 2 pounds and 6 ounces. She was really small for her gestational age. We were told that she had Down syndrome. We were not expecting that. The tests were not, the stuff that I had done on me was not indicative of Down syndrome, so it was a very big shock to be told that my child had Down syndrome. And what was so great is the developmental specialists and the nurses came in and were like, it's okay. Your baby is not Down syndrome, your baby is your baby. And Down syndrome does not define who your baby is, and it's going to be okay. And they really provided me with information and support. Every day somebody, just made sure that I was doing okay.
Hello, I'm Rachel, and I'm a former NICU parent. This video is made by NICU parents and staff because we care about you, and we know how difficult it can be to have your baby at NICU. We want you to know that you're not alone. This video is just the start to the care and support you will receive during your baby's stay.
If your family did not receive a badge at your baby's admission during your first visit to our NICU, you'll need to pick up the phone outside the locked door. A unit clerk will answer the phone. Please tell them your last name. They will let you in and escort you to your baby's room.
Hi, Ms. Smith. I'm Belinda. Congratulations on your baby girl.
Thank you.
Our unit is a locked unit. Each family gets 2 passes. These passes will allow you access to the NICU. Remember to always have your passes visible. This pass is for you to keep throughout your baby's entire stay in the NICU. Please do not give this pass to anyone else. You will also be given a special number code to identify your baby when you call the unit. If you do not wish for someone to receive information regarding your baby, please do not share this special number. On admission day, you will receive a folder in your baby's room. This folder is different from the folder that you received in your room. It's very important that you take the time to review the folder. A lot of your questions will be answered in your folder. You will need to swipe your pass at the family door to enter the NICU. Each parent must scrub up to their elbows for 3 minutes, either at the scrub sink prior to entering the NICU or in your baby's room. Please remove all watches and jewelry before scrubbing. Scrubbing is very important because it helps keep germs away from your baby. After your initial scrub, please remember to clean your hands with the gel sanitizer or by washing your hands for 20 seconds prior to touching your baby. This will help keep germs away from your baby. When entering your baby's room, we ask that you call your nurse and let her know that you have arrived. Your nurse will be in your baby's room shortly to give you an update. When your baby is admitted to the NICU, he or she will be placed in a heated open warmer, placed on a monitor, started on IV nutrition, and if needed, be placed on respiratory support. An open warmer is a special bed that monitors your baby's temperature and provides heat when necessary, while the team has easy access to your baby. Your baby will have leads placed on his or her chest, as well as a probe on a foot or hand that is attached to a monitor. The monitor tells us your baby's heart rate, respiratory rate, and oxygen saturation. Your baby will be on IV nutrition until feedings can begin. Some babies will require respiratory support from either a ventilator, CPAP, or nasal cannula. Ventilator, respirator, or breathing machine is a machine that delivers breaths to your baby. It may deliver all of your baby's breaths or just some of them, depending on how much he or she is attempting to breathe on their own. Your baby will have an endotracheal tube, also known as an ET tube, that is inserted through their mouth and into their airway. The ventilator will be connected to the ET tube and deliver oxygen and pressure to the lungs. CPAP, also known as continuous positive airway pressure, is a machine that gives pressure to your baby to keep the small sacs in the lungs open. The pressure is delivered by either mask or small prongs that fit inside the baby's nose. Your baby is breathing on his or her own, but requires additional pressure in order to effectively exchange gases. Nasal cannula is a small clear tubing that fits just inside your baby's nose and delivers oxygen. While your baby is in the NICU, he or she will be closely watched by staff using our monitors and phone systems. Every baby has their own monitoring equipment that displays their heart rate, respiratory rate, and their oxygen saturation. While your baby is in their room, your nurse can view and monitor your baby from any of the monitors throughout the unit. Every nurse has a phone they carry with them that allows them to receive these alarm messages regarding your baby. Your baby's monitor will have alarms set, and when your baby's alarms need a response, it will be transmitted to the nurse's phone immediately. However, there are some alarms that are not harmful to your baby, especially when they occur for short periods of time. We have designed our system to provide a safe environment for your baby. If you have concerns or are feeling anxious about the alarms in your baby's room that a nurse is not responding to, please talk to your nurse and he or she will explain them to you. These phones are also a way to communicate with your nurse. You can call and receive updates from your nurse about your baby's condition during their stay in the NICU. Whiteboards are used for communication. Your nurse will have her name on the board with her phone number. Other team members may also leave you information on it. Please check your board daily. You as parents are not visitors. You're a very important part of your baby's care team. We encourage you to stay with your baby as much as you are able. We provide a pull-out couch and a recliner in every room. If you decide to spend the night with your baby, we do ask that you are up and ready for rounds by 9 a.m. Please feel free to personalize your room. You may place pictures on your whiteboard and in the baby's bed. You can bring in a tape recorder of you singing to your baby or reading a story. We have a family lounge for you to watch TV, surf the net, and socialize with other families. There is a refrigerator and microwave for your convenience. In compliance with safety regulations, you will need to label and date all your items or they will be discarded. There are lockers available for you to store your belongings. In the parent lounge, we have a washer and a dryer for parents to do their laundry. We also have a chapel available to families and can provide chaplain services as requested. Some parents may like to use our quiet room to talk in private or have meetings with doctors regarding their baby. For parents who may stay overnight with their baby, we have showers available outside the parent lounge.
New Hanover Regional Medical Center provides support to families who have a baby in the NICU by having trained support parents and family-centered activities. As a former NICU parent, I now come back and support families who have a child here now. The Support Parent program at this hospital is through Family Support Network, a nonprofit organization whose mission is to help families who have children with special needs. We believe the best support comes from someone who has been there. It is comforting to know that you're not alone and that there are others who are understanding all the emotions that you are feeling. We are here for you to walk beside you through this difficult and life-altering time. It is also comforting for families to read the stories that are displayed in our family area. We hope that one day you too will share your story to help comfort other families. The NICU Support Parent also helps host weekly support meetings. These are held in the Family Lounge. Talking with others who have experienced a similar situation can help family members feel less isolated and fearful. These meetings are held every Wednesday from 6:30 to 8, and we always offer food to the families during this time. We host events such as scrapbooking and football parties. During the holidays, we host Thanksgiving and Christmas meals so that NICU families can have a meal together. Monthly events are always posted by Family Support Network on the corkboard beside the family hand washing sink.
We believe in family-centered care and believe our parents are the most important part of our team. Family participation is important to the healthy growth and development of your baby. From day one, we want you to participate in your baby's care. There are many things that you can do for your baby. We encourage all mothers to speak to our lactation consultants. There are many benefits to providing breast milk for your baby. Some of these are decreased risk of infections, optimal feeding tolerance, optimal neurodevelopment, decreases hospital readmissions, increases mother involvement, and decreases incidence of chronic lung disease. While in your room, your postpartum nurse will provide you with a pump and a kit, and for your convenience, we will also have a pump and kit in your baby's room. You will be on your way to providing good nutrition for your baby. You are a very important part of your baby's team, and we encourage you to participate in your baby's rounds. You will be the constant person in your baby's life, and the team values your input. When your baby is admitted to the NICU, they will be in a private room which will help keep their room quiet. We will also place a quilt over your baby's isolette to keep the bright lights off and use boundaries for positioning and containment to help them sleep better. Although your baby can't speak to you, they can still communicate with you by letting you know when they don't like something and are trying to avoid it. They do this by squirming, arching their back and neck and pushing away, by raising their hands in front of their face and spreading out their fingers. Other signs of stress or overstimulation can be seen by a change in your baby's vital signs. Your nurse will review this with you. One way to help calm your baby is by cupping their head with one hand and their bottom with the other and bringing their legs up to their body. We call this hands-on containment. Remember, when touching little babies, use your whole hand and provide light pressure. We do not want to lightly stroke them because it gets them very excited. At this time, that may be too much stimulation for a preterm baby. Kangaroo care is something else mom and dad can do to help your baby. It's known that kangaroo care can help your baby breathe better, sleep better, gain weight faster, and go home quicker. We encourage parents to be with their baby as often as they can. You are the consistent person in your baby's life. Research shows that babies go home sooner when parents are able to stay with their baby and assume their daily care while in the NICU. Please, if you have any questions, feel free to ask your nurse to contact our developmental specialist, Dr. Donna Vaught. Again, welcome to our NICU. We strive to provide the best of family-centered care. We hope this video provided you with the information to smoothly transition you and your family into the NICU environment. If you have any further questions, please feel free to contact any member of your baby's team.